Do you or someone you care for have an appointment for treatment at the St John of God Murdoch Hospital Cancer Centre? If you do, you may be feeling anxious or worried about the challenges you're facing. We've prepared this video to introduce you to the centre and our people. We hope that it will help you feel more comfortable and prepared for your first visit. We're all very proud of our centre and its commitment to St John of God's core values of hospitality, compassion, respect, justice and excellence, and we look forward to providing you with the best care and treatment possible. Our team includes specialist cancer doctors and nurses, allied health staff and pastoral care practitioners who work together to ensure that we consistently provide a high standard of care with compassion and empathy. Before we show you around the centre, it might be helpful for you to know a little bit more about where we are and how to find us. The Murdoch Cancer Centre is part of the St John of God Murdoch Hospital campus, which is located 16 kilometres south of Perth City via Kwinana Freeway, with easy access by bus and train services. The centre is fully self-contained with its own entrance, reception and administration areas. And of course, our specially designed treatment cubicles. Parking is available on the site, although parking fees do apply. And there is a drop-off area directly under the centre if walking is difficult for you.
If you live outside the metropolitan area, you may be interested in finding out about a government scheme that can assist patients with travel costs.
Our specialist cancer doctors, nurses and allied health staff provide individualised care and treatment for a large number of patients each week. So our waiting area is usually a busy place. While our reception staff do a great job in keeping things running smoothly, there are a few things that you can do to help them help you. Appointments for treatment are organised between your doctor and our clerks in the Cancer Centre. The appointment information will then be forwarded to you. If the times conflict with other appointments you may have, you can call us to ask if a different time is available. Our reception staff will greet you on arrival and work with the staff to ensure your treatment and visit run smoothly. St John of God Murdoch Hospital is a private hospital and fees may apply. Once you and your doctor have decided on the best treatment for you, it's a good idea to talk to your health insurer to check your level of cover and any excesses you may need to pay. We'll also need to set up a pharmacy account for your treatment medications. When you come for your first treatment, please make sure that you have your Medicare and health insurance details, a recent medication list, and any other information you may have that's related to your treatment, such as any other doctor's appointments or hospital visits. It's always worth arriving 10 minutes before your planned appointment time so that we can complete any extra paperwork or answer any questions you may have about your treatment. This will include making sure that the information we have in your medical records, such as your personal and contact details, are correct. Once the paperwork is done, you'll be seated in our reception area until it's time for you to be taken through to start your treatment. Occasionally, despite our best efforts, there may be a delay before your treatment commences. If there is a delay, we will let you know and explain why.
Of course, if you have any questions about fees or any other concerns, please feel free to talk to us so that you are fully informed.
Your treatment is individualised to you and your particular diagnosis. Before you commence treatment, you will have discussed your cancer and the treatment that's most appropriate for you with your doctor. This is a good time to raise any other questions you might have about any aspect of your treatment or care. Research tells us that people who feel well informed about their cancer diagnosis and treatment feel less anxious and more in control of what is happening to them. This is as true for family and friends as it is for patients themselves. You can discuss concerns you may have about treatment side effects, returning to work, or planning a holiday. Ask for repeat prescriptions or administrative things, such as forms you may need for insurance purposes. Many people tell us that they feel anxious at some time during their treatment. If you'd like to talk to someone about any worries or concerns you may have, social workers are available for this purpose. Just let one of the staff know and it can be organised. Each visit, before you have your treatment, a nurse will carry out a full assessment of your health, including checking your blood pressure, temperature, height and weight. We'll also talk to you about any side effects you may be experiencing. And because people sometimes feel tired or unsteady on their feet during treatment, we'll ask if you've had any falls. Before your session starts, the doctors and nurses will check the results of any other tests or scans you may have between visits to make sure it's safe for you to have your treatment and to help you stay as well as possible as your treatment continues. At times, this may cause a delay, as the results might suggest that it's safer to wait a few days or even a week before your next session to make sure you're as well as possible before you have more treatment. Before each session, we'll ask you to tell us how you've been feeling and any concerns you may have. We want to know about anything that worries or troubles you so that we can make sure you receive the best care and feel as well as possible during your treatment. Many patients tell us that one of the things they worry about is having to have needles inserted into veins so that treatment can be administered. Our nursing staff are very skilled in placing needles, and we recognise how important it is to do this well. Tell us if you have any particular concerns or fears about needles. At every visit, before you have your treatment, your medication is checked by 2 nurses. One nurse will ask you to state your full name, date of birth, and state any allergies you may have. While it may seem repetitive, it is a legal requirement to make sure the right person has the right medication every time.
While you will have answered all of the questions before, please be patient with us because it is a vital part of the safe delivery of your treatment.
Team cares very much about your well-being. We know that you'll have lots of questions at different times about new symptoms or side effects you may be experiencing, or concerns about things you can do to keep yourself well. You can talk to us about anything at any time. There's no concern or worry too small for us to want to hear about, so that we can work with you to find solutions to anything that's troubling you. Side effects can vary from treatment to treatment, and people experience them differently. Most side effects can be managed, and there are many medications we can use to help prevent or limit them so that you can carry on with your day-to-day activities. Different kinds of treatments have their own pattern of side effects, and it's not possible to cover them all here. However, when you start your treatment, the nurses looking after you will talk to you about possible side effects, and throughout your treatment, they'll keep asking about any side effects you may be experiencing. Our nurses and pharmacists are here to help you with any queries you may have, so please talk to us. Nothing is too small or unimportant to ask about. There may be times at home when you do not feel well. We'll give you contact numbers for both daytime and after hours. Please use them. In the event that you contact the centre or the after hours number and we feel you need to see your doctor, we'll contact them to make sure you get the attention you need as soon as possible.
Unfortunately, it isn't unusual to experience some side effects from your treatment, and it varies from person to person. What is important is that you tell us about what you're experiencing so that we can help you to feel better.
While the length of time people spend in the centre for treatment varies from patient to patient, we want to make sure that when you're with us, you're as comfortable as possible. During treatment, you may find it helpful to talk to someone about how you're feeling. Our pastoral practitioners can provide sensitive emotional and spiritual care to support you and your family at any time. And if you'd just like some company as you sit through your treatment, our volunteers are always ready for a chat. Of course, you may want nothing more than a cup of tea. We always have a range of beverages, light snacks and soups available on request.
If you feel hungry, please don't hesitate to let us know. We will always have sandwiches, soup and hot and cold drinks available.
Research from around the world shows that staying as active as possible during and after treatment for cancer helps people cope with treatment better, recover more quickly, and experience less fatigue, worry, and poor sleep than people who do not exercise. You can ask us for advice about the kind and amount of exercise you can do during and after treatment. Choosing a healthy diet, not smoking, and reducing your alcohol intake will also help you to keep as well as possible during the treatment. These have all been shown to help people recover more quickly and can help prevent some cancers from returning. Taste, smell, and appetite can be affected during treatment, and some patients become less interested in eating. This may lead to weight loss, which can impact on your overall health. You'll be weighed before each treatment session to check for any weight loss, and our expert dietitians are on hand to help you maintain or regain weight.
Research has shown that keeping active is a great way to maintain your energy levels, stimulate your appetite, and keep you feeling well during and after treatment. Ask us about exercise advice, or we can refer you to an exercise specialist.
When you start your treatment at our cancer centre, you're not doing it alone. We have a highly experienced expert team to care for you and your family throughout your treatment. The information we've presented in this video is based on valued feedback from patients who've shared their experiences with us. Here are some tips from past patients that may be of help to you. When you come for treatment, it's a good idea to wear layered clothing to make access to your arms and chest as easy as possible. And bringing a family member or friend as a second pair of ears, particularly at the beginning of your treatment, can be really helpful in remembering what's been said, giving you a better understanding of the things discussed or things that weren't clear and you'd like to ask about again.
Of course, if there is anything that you don't understand, need to know or would like to discuss, you only have to ask. We are all here for you.